And what does Congress think? Let's talk to Texas Representative Dr. Michael Burgess, who spent 3 decades practicing medicine before he became a guy in Washington, D.C., who works in Congress. Good morning to you, Congressman.
Good morning. I'm still just a regular guy. Thank you.
You are still a regular guy. So we're looking for some straight talk here regarding this. You know, the Democrats make it sound like, oh, these Republicans are going to blow up everything and 20 million people aren't going to have health care. That's just a lie, isn't it?
I don't want to that's a little strong for the characterization.
True, is it?
It's not true. It's a propensity for prevarication that they shouldn't do. You're correct.
Okay. So the big question, and what they're doing right now is and we're going to run some sound on this a little later on, is they're pushing kind of a scare campaign. So the people are going to be afraid that the insurance they've got, they're going to lose. That's not true either, is it?
No, and you know there's a way to do this correctly and carefully, and I think the president-elect yesterday, when he tweeted out, "Be careful," and that's a good admonition for all of us to bear in mind. Remember, when Obamacare started, they weren't so careful, and I was one of those 5 million people who lost their perfectly good high-deductible health plan, which the president told me was junk insurance, but it worked well for me for a number of. So, yeah, do be careful. One of the things that really strikes me is, I talk to people about this, and I have for years, is they are tired of someone up in Washington, D.C. messing with their insurance. And to tell you the truth, one of the things that I would really like to do, we've got to move more of this activity back to our states. That's where it belongs. That's why health care wasn't in the Constitution. It was a 10th Amendment issue. And our states are much more capable of dealing with this on a more individual basis. Sure. We don't need a bigger government. We've got a big enough government. It gets bigger as Obamacare becomes stronger and stronger, but the people become weaker and weaker.
Well, I tell you what, yesterday while Mike Pence was talking to members of his caucus up there on Capitol Hill, Chuck Schumer was soundbiting across the aisle, talking about, well, actually kind of taking Donald Trump's Make America Great Again and turning it on its ear. Doctor, listen to this.
Okay. The Republican plan to cut health care wouldn't make America great again. It would make America sick again and lead to chaos instead of affordable care. Republicans would create chaos in the health system because they're stuck between a rock and a hard place and have no idea what to put in place of the Affordable Care Act.
And see, that's, Doctor, what the Democrats are pushing right now. They're saying, okay, the Republicans are going to blow up Obamacare, and then it's going to be a while before they come up with some other cockamamie Plan B or Plan C or Plan D. You've got a plan right now, don't you?
Well, yes, there are a number of Republican plans that have been out there for a while. I introduced H.R. 35 just as we went through the first day of Congress, which is an expansion of health savings accounts, which is, I think, a good idea. It's not perfect for everyone, but for heaven's sakes, we ought to give people the option of doing what they would prefer to do. But here's the bigger thing, and, you know, that access to insurance isn't always access to care. And when I had an unsubsidized Obamacare policy a few years ago, I had a big deductible, $6,000. You get a kidney stone at 3 a.m., guess what? You've got a $4,000 emergency room bill that is hard to pay, especially for folks who have trouble covering the cost of a flat tire. So the coverage issue is a myth. The functional uninsured number in this country is really quite high.
And excellent question. Donald Trump has made it very clear he thinks that everybody in America should wind up with health care. Are you of that opinion as well?
Look, it is the responsible thing to do for fathers, for mothers, to have health care for their children, for their families. It is risky to depend upon your government for that. Sure. You do need to make those provisions yourself. That is what this country was built upon. It wasn't built upon the largesse available to us from whatever governmental source. Right. However, and please, I do understand this and I recognize this, and I dealt with it throughout my entire practice life. Safety net programs are important. Even if you did not do a thing with Obamacare, you still got some massive issues that are dead ahead of us in this Congress. The State Children's Health Insurance Fund runs out of money on September 30th. We are going to have to deal with that, like it or not, from the right or the left. That is one of those things that has to happen. What if we collaborated with our state partners and said, look, let us fix this thing rather than running out of money every 2 years. Let's give the states the flexibility that they have been asking for, they have been demanding, in conjunction with providing that money to them.
Sure. All right. Well, thank you very much, Congressman. We know you got a busy couple of days up there on Capitol Hill. We thank you very much for dropping by. Dr. Michael Burgess of the great state of Texas. Thank you, sir.
Thank you.
You bet.